Hi everyone, welcome to my channel Share and Care. I'm Sachin Gavde and today we are taking different topics altogether. We covered reversal of diabetes, we covered fasting, and today we will discuss about our dental care, oral care. I have with me Dr. Hardik Shetty and Dr. Gaurav Patil. So, Dr. Hardik is basically oral and maxillofacial surgeon, and Dr. Gaurav Patil. He's a Gaurav Patil, Hardik Shetty with me. So, Dr. Gaurav is orthodontist and dentofacial orthopedic. So, we will deep dive into that. What is exactly about oral health and dental care. We talked about so many things on health. Now this is the time we should not, we don't take care of our, we should aware about our oral care, and that is very keen topic. Generally I see out there in society people are ignoring their dental care, and this is happening since many decades. Things have changed after COVID, things have changed so many decades, and to be honest, I'm excited to have this session with Hardik and Gaurav. We came across our path discussing my wisdom tooth. Hardik was extracting my wisdom tooth and we were discussing, and really I would like to tell one story, and I always start my channel with a story because these guys have something, have done something in my health, or they do something inspired me so well that I want them on my channel because they are best in their field. So the people don't know about dental oral care. We will discuss. We will definitely deep dive into that. Before start off, I just wanted to take off on the topic of my question to Hardik first. Welcome Hardik and Gaurav on my channel. Basically, my channel Share and Care is mainly about people. They really don't know the basic things. We are not talking about the more into the technical part and stuff, but during our discussion, when I came to you, and then you discussed me and wisdom tooth. We discussed, I think, almost 15 minutes about the wisdom tooth. And to be honest, at the age of 46, I was not about the why wisdom tooth is exist and why we should extract. Number one. Number two, when I see any English series, so in Western culture, they celebrated to remove the wisdom tooth at the age of 18. So that I really, I was confused. So first of all, let's quickly, 5 seconds or 10 seconds discuss on the wisdom tooth. Why we should have the wisdom tooth, and why it has not been used, and why it is taking so much of pain to the people once they getting in the aging part. So can you just throw some light on that?
Good evening, Sachin. Thank you so much. I feel very privileged to have been invited on your channel. Thank you so much for that, and also Dr. Gaurav here. So as we have, as all of us know, that wisdom tooth is something which starts bothering you a little later in your life. Let us say when you are about roughly 20 years of life or 25 years, it starts giving you some or the other problems. The frequent problems that we face are dull nagging pain, inability to bite, it gets swollen up sometimes, and then. So let me just briefly tell you why this thing happens and what is age has to do with this. So as a part of evolution, as we all know that if you see at the older human beings, our jaws would be bigger, larger, massive jaws to actually chew on very hard, rough kind of food.
Yeah.
But as you know, as everybody knows, over a period of time, due to the processed nature of foods that we consume, our jaws have shrunken in size. There is a lot of scientific evidence and data also which states that. So what happens is, as our tooth buds grow, and at a later point of time in life, when all the teeth have been accumulated, the 28 teeth, there is another 4 remaining, which is a part of our, history, or a part of our, everybody has it, and it has to come at some point. There are very few lucky people, in fact, in whom wisdom tooth don't even erupt, and they are not seen in the X-rays as well.
So it might possible that even you need not to be taken out wisdom.
Yes, of course. Okay. But there is one thing. It is not necessary that a wisdom tooth isn't causing a problem, and this is not evident. For example, a wisdom tooth might just be there and it might cause a cyst inside the jaw, which might be asymptomatic. Asymptomatic as in there might be no pain or any other feature.
Okay.
But then it is eating up your jaw from the inside. And it might end up damaging the neighboring teeth as well, which are very essential for functions of chewing,
Yeah.
So at some point of time or the other, it would be very ideal for you to keep this in your mind and go for a routine checkup. Any dentist could actually point out whether your wisdom tooth is creating a problem, might create a problem, so on and so forth. And as you know, now the people who are going to attend to you are the oral and maxillofacial surgeons, who are the main role of an oral maxillofacial surgeon is to get your tooth removed in case it is not positioned in a very good way. Usually dentists don't tend to attend to this. It's usually oral surgeons who...
So that is the challenge normally when you came across the wisdom tooth problems. There are so many things. Definitely we will cover in a different session only on wisdom tooth. I know you have a lot to say about wisdom tooth, because you were explaining me that okay, Sachin, this is what it will take stitches, may not, so
Correct.
So and so forth. I think that's the point. I thought let's get Hardik on this thing. I'm moving on to the Gaurav now. Gaurav, what do you think? What are the changes in dental industry as an orthodontist? What is the shift? What do you see the shift from 20 years and right now? What are the changes you see, and what are the current industries all about, orthodontics?
So hello everyone, and thank you Sachin for giving us opportunity here. So first of all, I would like to start with the changes, like as you said, like since 20 years. I'm just talking about 20 years. So before, when dentistry evolved, it's like long, like 100 years back. So, but we are just talking about just 20 years. What are the changes happen? So if you see, like in this field of the orthodontics, like what is exactly orthodontics? Orthodontics, where we align the teeth, and also we try to correct the jaws. Jaws in the sense, if there is any deformity in the jaw, we correct the jaws also with the help of the orthopedics. That's why our field, this specialty name is orthodontics and dentofacial orthopedics.
Okay.
So if you come to the point of the orthodontics, so orthodontics, like before, like people, they were not that much aware. Like people were like, they didn't have any problem while looking. Now if you see that they were happy with whatever they have, the teeth, like misaligned, and whatever, like their appearance, nature, natural, whatever it is there, they didn't want to change it. But later on, the people, when they came to know, like as like people, when they go out, when they I supposed to not talk about this, because it is something you can it's personal things. Anybody can, anybody has their own interpretation. So, but later on, people try to change themselves. Like they think like, no, maybe this doesn't look good. We should change. We should make it align properly. So this is how it goes changing. And now these days, if you have a minute problem, also people wants to correct that. Means this is happening, like before there was a big problem, still people were not so keen to
Keen to
correct
change, yeah.
correct it. But now these days, if you have a very minute little problem, people wants to correct it, and this is how it happens. Like this is change, the major change which I see now.
No, I fully agree. And in that matter, if you see, in that matter, people not only what you call conscious about their facial things. We are conscious about health. We are conscious about our body structure. We want to build our health. We
Health is wealth.
So health is wealth.
Yeah.
So it's not about, I mean, fine, I mean, if I want to look good and I really want to do that, and if things is happening for me, so it's fine, I mean, it's okay. And it doesn't go to only oral care, I believe, and the people are doing so many things. But yeah, I mean, it's a very good thing that you touched upon the part that the people are thought process have changed from the earlier 20 years back. We take it as nature give us. Okay, we are not looking into it, but
So
people,
if there are some major problems,
Yeah.
people they were treating that.
treating that. So my, I'm just extending the your talks and extension of the questions is, now there are two parts. What I see is, okay, I have the normal tooth or whatever facial, everything is normal, okay, and I will go to change because of some reason. I want to see some good stuff, and that is another part. But do you see the challenges from the medical perspective, and they need to these people are coming to you for treat you? I mean, treat them for
Obviously,
that.
like, see, I'll tell you one thing. This, as I told you, like, orthodontics is not just as a cosmetic treatment. It is has the functional treatment also.
Correct.
It is like when you have means I don't know like if you can imagine or no, but there is a jaw. Suppose this jaw at the early age, if you don't notice, if you take your child and if you see like if you don't notice his jaw is behind what it should be in the normal position, and if it is not in the normal position and it is behind, there are a lot of problems with the while chewing or while facial appearance or even from breathing. There are so many things can happen.
Good that he touched upon that point
Yeah.
of breathing. Actually, there is another very interesting and keen subject which is growing very fast. It is called as the study of sleep. So, one major factor that affects sleep is something called as your pharyngeal space.
Yeah, that's what.
As he said, there are problems like obstructive sleep apnea. This kind of
I've just read
Yeah.
that apnea, sleep
So,
apnea. Yes.
this if you don't correct it at early age, then there will be a big problem in the later on. That's why you don't think like just it is only as a cosmetic treatment people are coming to make it is beautified. No, this has the functional things also.
Oh,
We are actually dealing with some major problems, not only these things. So that has to be corrected.
So we are talking about sleep apnea. Terms is fascinated for me because I was reading a lot of books and I read that, but to be honest, I didn't understand. Again, coming back to my point, common people, like you said, you have not identified that child is having some issues, and after some times you identified as a common guy till date. I didn't aware about this particular subject, and which is that this is channel is about, and this is beautiful topic we came across now. So how this kind of things can identify as a common guy? How you think, or how you will come to know that yes, something is wrong with that particular dental. I'm taking as a generalized terms, okay? I'm not talking about the
Any
facial or
specialty,
this thing.
yeah.
Now, dental problem from the childhood or at the age, middle age or this thing. So, what is your philosophy on that? When do you people think that I should think about my dental? It's ongoing process. I agree.
Yeah, right.
Dental checkup, this thing. But what do you think about that as a dental surgeon or maybe orthodontic? First, Hardik, let us talk about.
So you Okay, I understand, Sachin, that since you being a common man and our viewers also, they would expect us to give a very realistic idea about this.
Absolutely.
So, I still remember back then during our examinations, we were asked tricky questions like from our examiners, our professors. They have done a wonderful job, and hats off to them. They have one of the questions that was asked to me. I still remember this. When should a infant or a child start brushing the teeth, or when should the parents start brushing the child's teeth? It was not an exam, but it was just a random question by our professor. So enthusiastic first benchers started throwing answers like 5 years, 4 years, you know. But we as backbenchers always silent, and finally the answer was as soon as you see the teeth in the mouth. Correct? This is the actual answer, and you'll be surprised.
That means the first tooth it erupts.
Yes.
You have to start the
Yes, and it's, see, I'll tell you, like, you know, it's a routine procedure. No, as a common man, you will not come to know if there, in case if there is not any major problem. Otherwise, for small things, you will not come to know what's happening, because it's a layman. No, even for us, if you ask me like some other disease, I may not find that, you know, in at early
Yeah,
stage.
correct. Agree.
Right? It is same as with the oral health also, even oral diseases also. So the best thing is that you have to do the routine checkup with the dentist. So when you every 6 months you just have a checkup.
Very well said.
And this is this thing is happening everywhere. Like, you know, if you say in the school, they are actually instructing to the kids, like, you know, you should have a oral health checkup every 6 months.
Yes.
And this program is
Yes.
been happening now since many years in US. In the US, they are doing it so well that they are actually doing it every 6 months. They are sending to the kids to the dentist. They are taking their reports from the dentist whether these kids have visited to the dentist or no. And according to that, based on that also, they have the other things that they are lying out.
Just wanted to add something.
Yeah, yes. Please go
I'm
ahead.
so sorry.
No problem.
So I just wanted to say this, that when we talk about Westerners, particularly people of the States or people in the United Kingdom, or as we mentioned, developed countries.
Developed countries, yes.
Now the thing is, Sachin said the wisdom tooth. I just forgot to mention this. I'm so sorry. The moment wisdom tooth starts erupting, or is it seen on the X-ray, they have to get it knocked off, and they have a timeline that when you are, as you said, you are an adult, you have to. This is like a milestone for them. So they end up celebrating it.
Celebrating, yes.
Now, in India, if you have to implement this, it will cause chaos and paranoia, because anything that, I mean, people have the tendency to question why. So this is where I would want to answer why you have to attend to your third molars, your wisdom teeth, because I will tell why. Human jaw size usually is pretty much smaller than the ones before. Now there is no space for the wisdom teeth to erupt. The foundation of the wisdom tooth, like let us say a bud which is there, which has to flower. Okay, but there is no space. So it will find the easiest way to come, and in this process it will start damaging. Now, Westerners, for them, health has been a very, very, very big and important part of their life. So rather than facing the agony and the pain and all the post problems that might come along, including damaging the adjacent teeth, which is important, they would rather knock it off at an earlier stage so that the problem is solved at the first sight, and it never occurs later.
This is a beautiful explanation, and that's what I was, in dilemma, that why it is not been implemented in our country, or mainly in Southeast Asia, and why it is celebrated. So, but science behind this, and down the line, 20 years back, if the situation you are saying is like jaw is shrinking, even our heights comparative to the people in 70 hair.
It is all a part of evolution. Sachin.
Evolution. So down the line, 20 years back, even that will be a major problem compared to your heart health, and maybe you can take any diabetes. We are talking about blood pressure. The first will be your wisdom tooth. Please take care of your wisdom tooth, and this is a sign. That's what touching about all this. But good insight.
And one more, the very good thing Dr. Gaurav mentioned, it is very advisable for people to visit the dentist, your family dentist, or let us say a public hospital or somewhere, or at least make an attempt towards it. The reason being that when it comes to damaging the teeth, we never fall back on chocolates or cigarettes or gutka or pan masala or pan or junk food or sticky foods or milk products that are very sticky or any of these things. So we damage our teeth for 20 years and then expect doctors to fix it in 20 minutes. So, which is also quite possible, and we can try to do that.
Medical doctor, I agree. I mean, you guys are always give your best to save the.
So this is what he said was very fantastic. That every 6 months it should be your target ideally, but then 6 months doesn't mean that you have pain now and then you wait, because I just showed it to him yesterday and today I have pain. I have to wait for another 6 months. No. The moment you sense something,
you just take medicine and for that period, if the pain stops, you keep it's okay. Till the time, next time, if they get the pains, this negligence is the part.
But taking your point on this, Gaurav and Hardik, about the routine checkup. Okay. Personally, I feel dental checkup. Okay. So when I got diabetics 2 years back, and then it was really my eye-opener incident, and then I started my checking blood every 6 months. I used to do it earlier 2 years, then I shrink that to 1 year, and now 6 months. So why? Because I have to check my D, I have to check my B, because I'm a fitness freaker and I'm into more of health rather than my own profession. I'm just thinking about the health, and I know that we are lot of things we are ignoring. And why dental is coming in my mind, because still people are not serious about dental care. This is first thing. So what is 6 months, right? You said 6 months, but my thinking is, okay, I'm a 46 right now, so I will start immediately, fine, no problem, it's done. But damage is damage, what you said, and doctor will take care of this, because we have the evolution has been done in technology also, and the other thing also. So coming to the point to check up and the problems, challenges nowadays. What are the challenges you face, which is quite, you see that it could have been avoided, it could have been easily fix it that time, like one of the story or one of the incident, if you have that, okay, it could have been done 5 years back, but it is too late now. So do you think is there any way?
Yeah, I'll tell you one thing, because our both profession, means we are in the same profession but the different specialty. So how it happens, something which, as you said, what happens if you would have stopped it earlier, and later on if you didn't notice it earlier, and later on what happens. So this is fortunately we are together, and so I will tell you the link of the story, how it goes. At the age of 8 years, 10 years, 12 years, 14 years, this if you say for the boys and for the girls, the growth spurts are different age.
Absolutely.
Okay. For the boys, suppose if you consider as a 14 years of the age is a growth period. After 14 years, the growth starts little bit slow. For the girls, after 12 years or 13 years, the growth little bit slower. So, before this age, if you notice if there is a problem with the jaw, you can correct it with the growth modification.
Ah.
Okay. Suppose as I gave you an example. If suppose somebody's jaw is behind and it's supposed to be get it into the front. So I'm just telling you in the layman language,
Correct.
because everybody should understand.
Should understand.
Otherwise,
Yeah,
there
yeah.
are the medical terms. for
Medical
that.
terms also.
Yeah. So I'm not taking all the medical terms. I'm just giving you a rough idea, like how it.
That's the
works.
main objective
Yeah.
of the channel.
So when you want to pull the jaw front, you have to do it in certain right age. Otherwise, what happens if you cross that age? Suppose that boy or girl, if she or he comes after 16 or 17 years, and at that time I see, like, the already growth is already stopped, the growth is already ceased, and the jaw is already behind. Now we cannot pull the jaw in the front. So how to pull this jaw in the front? That has to go with the oral maxillofacial surgeon.
Alright.
So the maxillofacial surgeon, he will explain you what exactly they do after this.
There are yeah, continue. There are some very interesting things that I would want to disclose. Yes.
Yeah. So this is what, like, before the growth ceases, we can make the modification with the orthopedics. This is the dentofacial orthopedics.
Correct. So certain age is there. It is easy to fix it, and it is easy to heal and easy to manage.
Yeah, easy to manage. There will be not much
Complicated.
trouble, complications, and
Okay.
easy to, like, for acceptance also, like for parents and for that kid. If you see them, like, for them it is they can accept it really easy.
Yeah, easily.
But after that, and if you ask what exactly surgery is that, and if you give that scenario, he will tell you the better, like,
The
what
surgeon comes
the
into the
surgeon
picture.
comes into the picture, then
So-
what the reaction is there.
So
He
as
will
we,
tell.
as we know that it is usually a multidisciplinary approach in this kind of situations that we follow. What we do is we supplement the growth as per what we want,
Yeah.
what is desired, because we see an anomaly, we see a mistake, and then we correct it accordingly. So there is some procedures known as distraction osteogenesis. Sorry for the medical terms again.
no.
In that, what happens is you cut the jaw at specific places in a very, very gentle way, and you place certain appliances that will modulate the growth of the jaw, and it will let it grow only in a restricted way. So you guide the jaw's growth as
Okay.
per an idealistic final result.
But it is easy to say this,
Yes.
but to make it as a practically,
It is
it
challenge.
is challenging how just to open the jaw, cut the jaw, put that appliance inside. It
Yes.
is not that practical, like, easy thing. It is
So
a major operation.
Agree. So basically, from our discussion, what I can at least take it as whatever you see the anomaly or whatever things problems has to be fixed, and that certain it is very easy and not complicated. But if you go further, that would be as good as difficult. I mean, as good as the big operations.
Yeah.
And it might patient have to suffer, and lot of things happen. Okay, complications and all. So good that we touched upon that point. Now quickly on that, what are the food? I'm just coming on the direct. I will throw the questions on the foods on the and dental. What are the things? What are the correlation of that foods habits and dental? So what are the foods which is really impacting? And if we really someone wants to eat that, and what they should take first, you can just mention 3 or 4 foods, 5 foods, if really they are really impacting the oral this thing, and if we really they want to eat, what they should do.
Now, talking about foods that impact the oral health in a negative way, there are plenty of substances. I'm very sure that a lot of people would be aware of it. The primary being sticky carbohydrates. What are the sources of sticky carbohydrates? Chocolates, toffees, anything with a lot of sugar in it. Again, sugar is the
Sugar is the main.
sugar is the
culprit.
blame child for everything. And then of course certain adverse habits meaning to say smoking and BD consumption in India, as you know, then gutka chewing, or anything that becomes addictive and it becomes difficult to live without. This is going to impact your oral health. And certain substances like tea and coffee also. It is remarkable to see that people who consume a lot of tea and coffee end up getting their teeth stained faster than their counterparts who don't consume.
Okay.
So, apart from these, anything else?
Any acidic things like
Yes, good point.
soda, cola. These all acidic things also harmful, like for the teeth.
So yeah, so I think I touched upon this point earlier in my episode that definitely these are the things you should smoking, chewing gutka, that has to be prohibited, and one should have think about that long, and that drive in India is going in a good way, that awareness is increasing, and this is going on, but we don't have option for that you take the gutka and then you do it and then it will go away. That is fine. Chocolates, yes. So chocolates you can eat, but at least you can, after eating chocolates, you can brush your teeth properly.
I would, sorry to interrupt Sachin sir, I would also want to say something in general. Now, chocolates may be addictive sometimes, as in it makes you feel good. So, you want your mind to feel good, for which you are penalizing your mouth. Your taste buds will give a sensation to the mind, and maybe there will be a dopamine release or serotonin release or something, some neurotransmitter in your brain that will give you a sense of pleasure. So ideally, the depressed state or the bad mood makes you consume chocolates. But then since one chocolate makes you feel good, you feel that having more of it is going to make you feel all the more better, which in turn is so detrimental to the sugar levels in your body as well as the oral cavity. Now, one small take-home message. Let's say if your child is asking for a chocolate, don't say that it is going to damage. Of course, yes, you would want to oblige your child by giving them a chocolate. But
And he wants to
you
enjoy
have to
it.
reinforce something here. You have to tell them, I'll give you a chocolate, but you should promise me that you're going to brush your teeth every day in a very good way, and especially immediately after eating the chocolates.
That's
Well,
good
that doesn't
message.
mean that entire day your kid keeps brushing his or her teeth because they are eating chocolates. Not like that. Whenever he gets the opportunity to brush the teeth or at least rinse the mouth, it is a fair way to deal with this chocolate or sugar
Any
problem.
food so sticky brown.
And one last point, actually, I want to add something, and this is, I'll tell you, it's not a something which is scientific or something, but
science
I'm
or
just giving you some, if you can, you also can try it. If you have a craving of eating chocolates or any sweet, any part of anything which is unhealthy, and if you have a craving to eat that thing, you take one small piece, you eat one small chocolate. In between, just fill it up with the healthy thing. Like suppose you are eating banana, take banana in between. When your craving goes away, take the last bite of chocolate again to make your taste bud again to get that taste.
So quantity matters.
The quantity matters, like even
in a one way.
In a one way, you are actually
you are enjoying chocolate
both.
as well, and you are taking care. That's a good message. I think it's beautiful.
Excellent.
Hardik and I think you guys have fantastic. I think we are going good. Okay, so moving on to the before wrapping, couple of questions I have. What is the relation of diabetes? On this question, I'll tell you. I was reading one book of Rangan Chatterjee. He's a London doctor, GP, general physicians, and he was taking Harvard's Eric Michael interview, and he said that your oral health is impacting diabetes. On the other way, on the other side, I'm not sure about that. And Harvard is not coming up with. They are studying it actually. So many studies, you know, the medical, you are the medical student, so many things are studying. So diabetic and oral health. So what is your thought in short answers? What diabetic people should do, or someone should do something so that they cannot get diabetic, or maybe other way around?
So, considering diabetes type 2, if we have to discuss about,
Yes.
because that is now the current devil in
Devil,
the world,
and
which is a lot of
everywhere.
people are.
I am the victims actually, so
Yes,
I would like to
afflicted
know
by
actually.
this, of course. So, yes, apart from your regular morning walks or exercises or whatever you try and do to suppress diabetes, now this is something very interesting. Oral cavity, as we all know, it gets exposed to so many things, so many gases, dust, and all these things. This is subconsciously, but then consciously, what we put it into our mouth, what we eat, will somehow affect our oral cavity also, and in turn our general health also. Now, we as dentists, we have this habit of noticing people's teeth, people's gums and stuff like that. I will tell you one thing, Sachin, in our practice, if we come across a patient in his 50s, or let us say these days even 40s.
40s, yes.
So, the moment we notice something wrong with the gums in a generalized way, not in one particular area, everywhere around, immediately our thought process points towards diabetes, because in most of the diabetic individuals in whom their diabetes currently might not be in a very good state or not controlled at the moment, it is definite that that person will have swollen gums or bad breath or loose teeth. Yes, it can go to that level also. So now there is another thing. There's a lot of studies and a lot of research going on. In fact, periodontics, as we say, is another branch of dentistry that deals only with the gums and the issues of the gums.
This is a extension of your.
It is one of
dental,
the branches,
one of
yes,
the
one of the
specialty
specialties
in dentistry.
of dentistry, and their research on this field is remarkable. You will not believe, Sachin. It is said that, now I want everybody to listen to this carefully. There is research going on, and very soon they will be able to prove through research and through their studies that having a good oral health, as in keeping your gums clean especially and your teeth clean and maintaining that oral health, will help you reduce your sugar levels and maintain your diabetic profile.
That is a good point.
Yes,
I think.
yes.
And the main important thing is you touched upon the exactly my near and dear subject of diabetes, and it's very good message to all people that. And Hardik said, it's very important that you have to take care of your gums. Now, when we talk about oral things, I think people might end up with the only teeth. Okay, oral is teeth, that's it. But gums is a very key portion, and that's what the message is about this. And that's the reason, I want people should know oral is what? Teeth, that's it, and for eating teeth. So we discussed about the one thing, and I would emphasize on that, Hardik, especially one thing, when you said to me that, Sachin, we lost certain things from the ancient. We have not taken it. So our forefathers and grandfathers used to clean the mouth before eating and clean the mouth again after eating. And this is happened every meal. They used to do it, and I really, to be honest, I really surprised, and I started doing myself because this is what you are getting stuff, and this is again the main thing. Objective is to know the people that small things make your life very healthy. So what is that? I mean, how it is impacting, and what message that time we discussed, and what is your thought to process or give it to the people out there that this should have been inculcated and it's very healthy habits actually. As what and why should we do that, and why our ancient is doing, and what is the impact of that?
If we see Sachin, our forefathers, whatever they did and the practices they followed had a deep meaning for that particular era and time. If you see back then, the food that we consumed are also very fibrous. Now, the availability of sugary foods or sugary drinks these days, you wouldn't even have to walk to the market to buy something, but you would have to walk to the market to buy an apple. But,
Other
for
way
example,
around,
you understand, right, where I'm getting at?
Yes, yes. It's the other
if
way
you
around
crave
actually.
something sweet, probably our ancestors would probably go to the market and buy a mango, or you know something that is just from the source. It doesn't have a lot of processing.
Correct.
Okay, but most of the things we consume today, nothing against bakery products or nothing against confectionery.
Yeah.
But then if you see that we have these quick solutions for our problems. I mean, hunger is not a problem. Hunger is a physiologic thing that should happen to everyone. But quenching the thirst or wrapping up your hunger, earlier days would be whole foods, healthier, nutritional
Yes,
stuff,
yes.
which is replaced these days by patisserie or samosas, or nothing against samosas. I myself love samosas. I'm so sorry.
Yeah.
But then, yes. So, as a take-home message, I would always want to say this, and I was always looking forward to share this on a public platform, that in the social circle, you can never avoid something abruptly and totally, because you're a part of a society and you need to attend to certain things that a society would want to do. But then, with those, your healthy habits should go in par. For example, I brush my teeth just because I have to, and because Dr. Hardik and Dr. Gaurav said it on TV. No. When you go to the bathroom and you stand in front of the mirror and you want to brush your teeth, it's a part of your body. Make sure that every part is gently brushed with a very soft hands, and not aggressively, because you just have to finish it. It is a part of your body. It is going to stay with you and it is going to support you. So this is one thing. Brush gently. Take your time. Make sure every surface is neatly cleaned. Make sure your gums are also clean. Rinse your mouth as much as you can throughout the day. Use mouthwashes if you like them. If you don't like them, also plain
Doesn't
water.
matter.
It
Yeah.
doesn't really
Water is
Yes.
enough, I think.
Yes.
I
That
think
is fine.
like
Does the job.
the one more thing is that you should drink plenty of water.
Yes. Very good
This
point.
is like to keep your oral environment healthy.
Simple message.
Simple message.
No need to be get into the technical and all.
Technical.
Water is
Take plenty of water
Water.
that gives you all the salivation properly. That saliva itself clean your mouth.
Ah.
You don't have to do anything outside anything. If you have the plenty of water, that saliva itself rinse your mouth.
absolutely.
Otherwise, you see, if you don't drink water, the proper quantity, you will end up with the dry mouth.
Yes.
Absolutely.
And that dry mouth leads to some other problems.
So many curves.
Very well said.
So many points. So many
And
points.
saliva is a line of defense of the mouth. Saliva protects the mouth.
Protects the mouth. It is our first covering of our mouth. This is beautiful thing. Like, you don't have to do anything. Just
And
drink.
that's the process, right? I think the mouth process is, eating process is you are taking food with saliva. And saliva takes inside and then digestion.
The primary digestion.
Yeah.
Since another thing I want to mention, Sachin sir, oral cavity is a part of the digestive system. So digestion begins
Yes.
even before the food is gone inside.
That's a beautiful,
That's the
beautiful
beauty of
message.
it.
Yeah, beauty of it. Yeah. And you see, this is what you see my earlier channel as well. These are the message you will not. To be honest, I have never seen personally myself before getting Hardik and Gaurav and sitting down with me. and discussing with this. And this is really, it's a popped up actually. It was not decided that we will discuss, because this is the flow we are going, and a lot of things I am also learning. And guys, please take care of your oral health, because that's what clearly message. Your even before starting your food, I mean, it's very important, right? It's a process, right?
Of course.
Okay, so good insight on the oral health. I have couple of questions before wrapping it up on this podcast. What are the technological changes? What do you see? Number one, and number two, in your both industry, I think Gaurav, technology changes. What do you see, and what are the future on this?
So see, if you talk about dentistry, there are many things. The technological changes has been happened. But if you talk about my specialty, I would say there are things I can explain earlier and now what is actually has changed. Earlier, if you whenever the orthodontics patient, we say as if there is some problem with any teeth or jaws or something with the alignment and malocclusion, something has happened to that person, so we say as he's a orthodontic patient. So before, in the beginning, before earlier days, they used to come, as a doctor we used to see, and normally the primary diagnostics would be if you say the x-rays. That time we were using x-rays and now also we are using x-ray. It is not like we were using only. Now also we are using. But x-rays were the main diagnostic thing, it was there.
Correct.
Later on it has changed to x-rays plus it is called CBCT. CBCT means there is a CT scan
3D.
of your 3D 3D jaw.
So I did that actually. You have to put your teeth on the certain area and then it move around you 360 degree.
Yes.
And that's the same machine.
That's the same thing. And after that, when you will see the exactly how it is inside the jaw, how it's a 3D.
So earlier they only used to take the teeth X-ray, right?
This
or
is
tooth
2D.
X-ray.
The X-ray radiological, just the radiographic,
Correct.
that is 2D.
But now you will get entire jaw.
Entire jaw, exactly how it is there inside, what findings are there inside.
Sorry sir.
Yeah.
Sorry to interrupt you. The X-ray is just like if you have a object here. There's a X-ray which comes and there's a plate which captures it.
Simple.
So things in between get superimposed on each other. So you wouldn't know what is in front and what is behind because everything is superimposed on that two-dimensional thing. But CBCT is a 3D thing wherein you can actually see it as a whole object. So very good point and it's a perfect
So
advantage.
later on, these advances that came. Now, with that, all these things are carry forward. It is not like one is ruled out and other thing is coming up. Nothing like that. Still, it is carry forwarding.
Okay.
They are adding up.
Adding up, okay.
Still, people are taking 2D X-ray plus CBCT. Now, in my field, if you say we need mandatory to have these things, plus if you can say that we used to take this impression to for the set of the teeth, we need something to imprint it. So we call it as an impression. So we take it as an impression, we make a model on that, and then if we want to make something on that, we used to work like that. But now the recent advances, if you say it is a 3D scanner, you don't have to take the imprints of your teeth. You can scan it. You can put it in your laptop or computer, see exactly how your teeth are there, exactly what it is there in your mouth, we are putting in your computer.
So basically there is no physical intervention
There is
to take the impression. No physical intervention.
No,
so technology
completely.
And the human errors are
minimized. Eliminated.
Almost
Not eliminated.
eliminated.
Almost eliminated.
And there are a lot of things you can
They used to
make
put some I don't know.
Alginate. It is called alginate.
Okay.
Yeah, it's the most commonly
This
used
is,
for
yeah,
the
I've
impression.
seen multiple. Whenever I visit dentist, I see the what do
Yeah,
you call
this
as a
powder.
denture
Yeah,
on
denture.
this, and they used to take and that. But now they completely no physical intervention,
No physical intervention. Now you can take directly the scan of your teeth,
and then
put it in your computer. What you
Huh.
want to do, you can make it
Alright.
according to that. And this is just I'm talking about in the
one
diagnostic
of the
thing.
diagnostic thing.
Other thing, like in the part of the treatment, if you say in the part of the treatment, before we used to, means now also, but we are using the braces to correct the teeth. It is called the metal braces, ceramic braces, if you know if you
Yeah,
have
yeah.
heard the name of all these things. But now with the scan, we take the scan. It's been there for since 20 years, but recently it is booming up,
Very popular.
very popular. So we take the scan, we make the aligners. It is called aligners. It's just a thermoplastic material. With that, with the help of that, you can correct, we can align our teeth. You don't have to actually put the braces. It is invisible completely.
Ah.
So
Earlier they used to put the braces. Now
yeah,
it's replaced by this.
replaced by this.
So
Technological
and still,
changes is
and still
happening.
there is people are working on the more advancement. That was I was reading on the dental book that without physical intervention and artificial intelligence is
Yeah,
coming up.
yes.
So what about you in your case?
I wanted to also put this because you just mentioned denture. So I would want to say this. I mean, people are aware of this, I'm very sure. But then earlier, the most common treatments that people would hear about or people would come across would be removing the tooth, daat nikal diya, extracted. Okay, so now there's no teeth there. So what do? You make a denture. The ones we used to see our grandparents.
Grandparents used to
used
they clean and
they clean and they put it in water and
water exactly.
But these days, Sachin, I should tell you, there are these titanium screws, implants. They fit it in the jaw and then they fabricate a prosthetic thing. Like for example, how for people whose hands or legs are amputated, they have a prosthetic limb. In a similar way, what happens is they fit screws and on those screws they design a denture which is not made of that material, which is made of a material whose properties, hardness, color is almost similar to our normal teeth, our natural teeth rather. So this is one advancement, and even the placement of implants these days, it is quick, almost painless, and it is a very fast procedure because now, as you know, artificial intelligence and computers have come in. So computers give you a rough idea about where to place the implant so that the load dissipation of bite forces is managed well, and also depending on the age of the patient, depending on the size of the jaw, the amount of bone available, the condition of the gums, all these factors are kept into consideration, and you have like a plan ready for that patient. Now, provided he is up for it, considering in terms of the financial thing,
correct everything.
the time frame, his general health also.
Health
It's
also.
very important because, as I mentioned, these screws, it's called implants. In uncontrolled diabetic patients, it is not very advisable to do these kind of procedures.
Correct.
You know?
So that makes your job ease, or any? Do you think that getting that accuracy is your now challenges are increased, or you see that it is really helping you, or it's eliminated something? Definitely not, because I am into finance. Now I am getting numbers quickly, so I see that numbers are it's a real, because I do not see that number is really, because earlier I used to do maths on calculator and that numbers is satisfied me that yes I did it and there is accuracy. But depending on the machines, definitely there is a lot of people proven record, and without that it's not possible. So it's easy your jobs, or it's more challenging? and what is the future you see? Do you think robots will do the magic?
They are doing now also.
Oh shit.
It is a double-edged sword.
Double-edged sword, yeah.
You can never say. Technology can go both ways.
Yeah, I agree. But again, back to questions: is your job, or really it's helping you intervention of the technology into the, definitely all fields have done, but in your field, what is the cutting edge you have having that technology in your technology with you?
Of course, yes, Sachin. If you see, as he mentioned, our diagnosis,
Decision making.
decision making, treatment planning, and all these things are supplemented by technology. I mean, the decision makers and the execution of the plan. Of course, yes, it has to be the
That remains the same.
Yes, that remains the same. But these are like
Intellectual.
additives, Sachin.
Additives. They are
Intellectual,
giving
yes.
you an extra, like because ultimately you are the one, means we are the one who are going to place implant.
Exactly.
And that's the reason you have to spend so many years
Yeah.
of
But
Exactly.
but they are giving us an advantage, obviously,
Yes,
like which
absolutely.
how it is.
So there was this senior of mine, very charming, intelligent orthodontist, just like Gaurav sir. He told me that Hardik, let us just think if all healthcare had to be taken care of by robots or artificial intelligence, what would be the human's role left out? And then I was like, you raised a very good point there. Would our brains start to shrink then? Because we are not putting an effort, or we are not thinking in that direction. It is like we've come to that breakthrough point wherein we stop thinking, which is not why we are here in the first place.
And not joking, I think you have done journals in your medical, and a lot of you did, right? So, as you mentioned clearly, everything will be replaceable. Human intellectual property remains the same, or maybe the question is, are our brains or thinking process is shrinking, and that's the right way. So, wrapping up the session, I think one of the best things from Hardik and Gaurav we got today, to be honest, it's a treasure, and we will definitely get them again to give you more insight on dental and oral.